physical assessment of the genitourinary system. Welcome to today's lecture on the physical assessment of the genitourinary system. Genitourinary system problems are prevalent and can affect individuals of all age groups. If left unaddressed, these issues can lead to severe pain, morbidity, or even death. In this lecture, we will guide you through systematic approaches to assess genitourinary system problems and gather a relevant patient history for the genitourinary assessment. The primary objective of taking a patient's history is to understand the patient better, which is crucial for diagnosing and treating their current problems. This process involves gathering information from the patient in several key areas, including the chief complaint, the present problem, past medical history, and family history, to obtain necessary information. Consider the following questions. 1. Chief complaint. Start by asking the patient, what problem or symptoms brought you here? Follow up with questions such as how long has this problem been present, or when did these symptoms begin? 2. Present problem or illness. Inquire about the signs and symptoms of the problem. Ask when the patient last felt well. Explore what exacerbates the problem and what provides relief. Assess how the problem impacts the patient's lifestyle, including their marriage, leisure activities, ability to perform tasks, and ability to cope with stress. Determine the progression of the problem up to the present point, whether it has been steadily worsening or characterized by periods of improvement followed by periods of worsening. 3. Information specific to the genitourinary system. The genitourinary history should include specific details related to the urinary and reproductive systems. 1. Urinary system. Ask about any history of trauma. Inquire about any prior infections or diseases. Explore the presence of incontinence. In other words, the inability to control bladder and or bowel functions. Assess for any physical abnormalities. Inquire about the patient's venereal history, as it can affect the reproductive system. Ask if the patient has experienced dysuria, difficulty, or pain in urination. 2. Reproductive system for females. Obtain a menstrual history, including details about the last menstrual period and postmenstrual pain. Ask about the number of pregnancies, also known as gravida, pregnancies carried past 20 weeks, and any history of abortions. Inquire about fertility for both men and women. Questions regarding potency and libido are typically reserved for extensive histories and should not be routinely asked in a physical examination. By following this systematic approach to gathering a patient's genitourinary history, you can better assess and address their gut-related concerns. The physical assessments of the genitourinary system have both similarities and differences for males and females. We'll also cover the procedures for rectal assessment, which are the same for both genders. Let's dive right into the assessment process, starting with the male genitalia inspection. Male genitalia inspection. Examine the foreskin by retraction. Check for phimosis, which is the constriction of the prepudal orifice preventing retraction over the glands. Look for lesions, including chancres, primarily associated with syphilis. Examine the glands for ulcers, scars, and inflammation. Check the location of the urethra. Hypospadias is a congenital defect where the urethra opens on the undersurface of the penis. Epispadias can occur in both males and females, with the male urethra opening on the dorsal side of the penis. Check for any discharge from the meatus. Examine the skin around the base of the penis for inflammation, nits, or lice. Check the scrotum for any swelling and inflammation. Male genitalia palpation. Moving on to male genitalia palpation. 1. Testes. Check for masses that are tender. Look for tumors that won't transluminate. Examine for spermatocele, which is a tumor of the testes. Feel for a varicocele, which presents as a swelling resembling a bag of worms in the scrotum. 2. Epididymis. Feel for a soft mass of tissue located posterior to the testicle. Check for signs of epididymitis, which is inflammation of the epididymis. For direct inguinal hernia, look for a bulge. Remember that a large bulge is rare and a minor bulge may only be felt with a finger in the inguinal canal. In the case of an indirect inguinal hernia, examine for the protrusion of abdominal contents through the inguinal canal, often extending into the scrotum. Note that an indirect hernia can resolve when the patient is in a recumbent position. Female genitalia inspection. Now, let's move on to the inspection of the female genitalia. Ensure you have the proper equipment ready, including a speculum, lubricant, and gloves. Advise the patient to void before the examination to minimize discomfort. Always ensure that a chaperone is available. Use a gloved hand to check the external genitalia. Examine the external genitalia for any signs of inflammation, discharge, swelling, or ulceration, including the labia minora, clitoris, urethral opening, and vaginal opening. For the internal genitalia, use a speculum to examine the vagina and cervix. Determine if laboratory specimens are needed for a pap smear or other scrapes or swab tests. Male and female rectal inspection. Lastly, for both males and females, the rectal inspection. Palpate the rectum for any abnormalities. Check for lesions on the rectal walls. Examine a stool sample for the presence of blood. This concludes our overview of the procedures for the physical assessment of the genitourinary system. Always remember to perform these assessments with care, sensitivity, and respect for the patient's privacy and comfort.